Are you tired of feeling embarrassed or frustrated over something you feel you can't control? You're not alone. Erectile dysfunction, ED, is a common struggle, yet the conversations around it are often clouded with misinformation and awkwardness. But what if you could reclaim control? Today, we're going to break down exactly how a group of medications known as PDE5 inhibitors are changing the game. We'll explore what they are, how they work, and even what natural alternatives might do the same job, so you're fully informed and ready to make the right choices for your health. What are PDE5 inhibitors and how do they work? PDE5 inhibitors aren't some magic pills. They're a specific type of drug designed to solve a problem that's far more common than many think. PDE5, or phosphodiesterase 5, is an enzyme found in the walls of blood vessels. Think of it as a barrier that can block blood flow, making it difficult for blood to circulate properly. When PDE5 inhibitors step in, they block this enzyme, relaxing the blood vessels, increasing blood flow, and ultimately helping to improve the body's ability to respond when it counts. So why do people take these? Mostly, PDE5 inhibitors are known for treating erectile dysfunction and pulmonary hypertension, but they're also being studied for heart disease, diabetes, and even cognitive disorders like dementia. Meet the players, popular PDE5 inhibitors. Let's go over some of the big names in the world of PDE5 inhibitors, starting with the familiar ones you may have already heard about and how they differ in terms of onset and duration. 1. Avanafil, Stendra, the newest kid on the block. Avanafil works fast, usually in just 15 minutes. It doesn't stick around as long as some others, but for spontaneous situations, that can be a plus. 2. Vardenafil, Levitra, known for lasting about 12 hours, Vardenafil kicks in after 60 minutes, providing a nice window for those who may want a little extra time. 3. Tadalafil, Cialis, if you're looking for something long-lasting, tadalafil is it. Often referred to as the weekend pill, it can last up to 36 hours, giving you more flexibility. 4. Sildenafil, Viagra, the one everyone knows about. Viagra takes effect within 60 minutes and typically lasts about 12 hours. Why do you need a prescription? Unlike over-the-counter options, PDE5 inhibitors require a prescription. This isn't just about regulations, it's about safety. These medications have significant effects on the cardiovascular system, so you need to talk to a healthcare professional to ensure they're safe for you. Some telemedicine companies, like Hims and Roman, have made access easier by offering online consultations. After a quick visit with a licensed professional, you can get your prescription and have it shipped discreetly to your door. Plus, these options are often quite affordable, with some starting as low as $2 or $3 per dose. Beyond prescription drugs, natural alternatives and supplements. If you're leaning toward a natural approach, there are alternatives you may want to consider. But here's the key: while some natural substances do have PDE5 inhibiting properties, not all are proven effective or safe. Let's look at a few. 1. L-arginine. Found in foods like turkey and pumpkin seeds, l-arginine may support the effects of PDE5 inhibitors, though on its own, it may only offer mild benefits. 2. Yohimbine, an extract from an African tree. It's sometimes used to treat ED. However, it comes with risks, as it has been linked to heart attacks and seizures. 3. Black ginger. This plant contains small amounts of PDE5 inhibitors. A 2018 study showed potential, but more research is needed to determine its safety and effectiveness. 4. Tonkat Ali and Tribulus terrestris, known for potentially boosting testosterone and libido. These two plants offer limited but promising results. Remember, just because they're natural doesn't mean they're without risk. 5. Horny goatweed. While popular in traditional medicine, there's limited clinical evidence for its effectiveness in humans. An old study on rats showed promise, but you should take these claims with a grain of salt until more research emerges. When should you avoid PDE5 inhibitors? PDE5 inhibitors aren't for everyone. If you're on nitrate medications for heart issues, you'll need to steer clear. The combination can result in a drastic drop in blood pressure, which can be life-threatening. Common nitrate drugs include nitroglycerin and isosorbide. Additionally, if you have specific health conditions, like severe heart problems or uncontrolled high blood pressure, PDE5 inhibitors might not be a safe choice for you. Beyond nitrates, you'll also want to be cautious with alcohol and grapefruit juice, which can interact with these drugs, amplifying side effects or diminishing effectiveness. Possible side effects: what you need to know. For most people, the side effects of PDE5 inhibitors are mild. You might experience headaches, flushing, or symptoms that feel like a mild cold. More serious side effects are rare but can include vision changes, sudden loss of hearing, and prolonged, painful erections, which require immediate medical attention. Considering supplements? Watch out for scams. The FDA regularly warns consumers about supplements marketed as natural-led remedies. Often, these products contain undeclared PDE5 inhibitors that can lead to serious side effects or interactions. Worse, they're unregulated, so you never truly know what's in them. Before trying any supplement or herbal remedy, talk to your doctor. Just because something is labeled as natural doesn't mean it's safe. Taking the time to research and consult a professional can save you from unintended consequences. When to seek help for erectile dysfunction. If you're finding it challenging to maintain an erection, don't be afraid to speak up. Doctors are trained to help you, and they'll ask questions to get a complete picture. They may inquire about your sexual history, lifestyle, and other factors like stress, medication use, or underlying health issues. Based on your answers, they'll recommend the treatment options best suited to your needs, which might include lifestyle changes, prescription medications, or a combination. Addressing your questions, quick facts. Let's address a few common questions about PDE5 inhibitors and ED treatments. Can I mix caffeine and Viagra? There are no known interactions, but it's always wise to check with your doctor. Do any foods naturally contain PDE5 inhibitors? Certain herbs and plants, like black ginger and horny goatweed, do, but the evidence isn't strong enough to rely on these alone. Are there risks with supplements? Absolutely. Many so-called natural supplements contain hidden ingredients that could be dangerous. Always consult with a healthcare provider before taking any supplement for ED. Conclusion: living with erectile dysfunction or pulmonary hypertension doesn't have to mean living with constant frustration. PDE5 inhibitors offer options, and today, we've explored not only the traditional medications but also the natural alternatives, along with their safety considerations. Whether you're looking into Avanafil for its quick onset or considering tadalafil for its long-lasting effects, there's a solution to fit your lifestyle. Remember to consult with a healthcare provider before starting any new treatment, and be cautious with supplements promising quick fixes. You have options. Now, armed with knowledge, you're ready to make the best choice for your health and well-being. Thanks for watching, and remember, your health journey is yours to own.